Peace TV English, the solution for humanity.
Dear brothers and sisters, Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to a new episode of Health. Renal colic is a pain that comes in the back, and usually it's very intractable, and usually the patient goes to the hospital with a severe pain, and of course some of us had this pain and experienced this very hard moments. Today we're talking about the renal stones and their effects and how can we treat them. So we have with us today is Dr. Muhammad Hatim, consultant of neurosurgery. Welcome, Dr. Muhammad.
Welcome, Dr. Ahmed.
Renal colic is a very painful thing.
Renal colic is one of the most annoying situations for the patient.
When you're in the emergency room, and usually you can spot diagnose the patient with a renal colic. You see him in a severe pain, in a severe agony.
Sure.
And
the patient has a very intractable pain. The patient can do anything to get rid of this pain. It's really intractable pain and very annoying situation.
Yes, definitely. But what are the most common causes of this pain, the renal colic?
Anything that causes obstruction in the urinary tract, all through the urinary tract, can cause this renal pain. Like stones, the most common, blood clots, tumors, all this can cause renal pain. Another thing that causes renal colic or renal pain, but it's not so severe, but we usually see it in our clinics, is hyperuricemia. Passing of urate, amorphous urate, or other crystals through the urinary tract can cause renal colic.
So if we want to talk about the stones, which are, you said that's most common cause of the renal colic, what are the stones? Because this is the most commonly heard about. You have a stone in the ureter, you have a stone in the kidney, you have a stone in the bladder, and people would wonder, what is the stone?
The stone is the aggregation of crystals, either calcium oxalate, amorphous urate, phosphates, whatever these crystals are, on a nidus, and it's variable in its size.
Nidus is like a nucleus of the stone.
Usually it's a bacterial infection.
Yes.
A dead bacteria, crystals aggregate on it and forms this stone. That's the stone.
Yeah, so there are many types of stones. I mean, you said there's sometimes calcium stones, there's sometimes the oxalate stones. What determines which kind of stones happen, and how different are they, one stone from the other?
Some stones form due to pathology, certain pathology. Metabolic disorders like hyperuricemia. Some form due to genetic defect, like cystine stones. Some, like struvate stones, are formed due to infection, and this usually occurs in women. But usually the main cause of renal stones formation is idiopathic.
Yes. So to give an idea about how the stone forms and where does it form, usually it forms in the kidneys, of course.
Not all the stones.
Not all
Most of the stones form in the kidney and they pass through the ureter. Either they are arrested in the kidney itself, in the renal pelvis, in the ureter, all through its course, or in the bladder. As we see in this picture, you can see this is picture of stones formed in the kidney, and this is after its treatment how it passes through the ureter. The stones can be found at any place in the urinary tract. It's usually formed in the kidney, except the urinary bladder stones. Usually the urinary bladder stones, when it is large stones, it had a certain another pathology. It's formed due to pathology in the bladder itself, like neurogenic bladder, like prostate. It's due to aggregation of crystals on a residual urine.
It does not start in the renal canal or the renal calyces?
The small stones start in the renal canal, of course. Yes. So it passes outside through the bladder and the urethra. But larger stones, when you found a larger stone in the bladder in the patient, he has a pathology in this bladder.
So somebody would tell you, what did I do to have a stone formed? You already mentioned some of the causes that would lead to formation of stones. But somebody would ask you, was it something that I did wrong? Is it going to happen to me again? All these questions that you have about the formation of stones.
You know, Dr. Ahmed, nothing could predict. Nothing, either familial, genetic, metabolic disorders. All this is associated with renal stones. But many patients have renal stones and there is no certain cause. There is no definite pathology for formation of the stones. I can tell this patient will not have stones. I can say this patient will have stone. This patient will be stone former. But there is nothing to say this patient will not have stone. That's it.
So somebody has a pain in the back or the loin, as we say, and they would predict that they have a stone. How would somebody know that he or she really has a stone?
First, the patient has experienced a renal colic. He will go to the emergency room, start to have analgesic. Then we start examination of this patient, history of this patient, either he is stone passer or not, either he has experienced this renal colic or not. Then we start investigating this patient.
But first, does it have to be all the time starting with a renal colic?
Not all the time. Sometimes there is silent stones. Silent stones.
Yes.
Some patients we found accidentally renal stones during our investigations for recurrent urinary tract infection, for presence of either microscopic or macroscopic hematuria. Microscopic means we found it in the urine analysis. The patient don't see blood in his urine. Macroscopic, the patient came complaining of having blood in his urine. So not all the patients with renal stones come with renal colic.
And the degree of pain should not reach to a colic so that the person should go to a doctor. If they have some discomfort or a moderate type of pain, should be referred to a urologist to examine them. And
as we said in the first question, obstruction in the urinary tract cause renal colic, not stone in the urinary tract. The stones that cause obstructions cause renal colic, this severe renal colic. The pathology of renal colic simply, we have the stone passing through the ureter, so it's arrested at any place of the ureter. When the stone is arrested, the ureter is like a tube.
Yes.
You can see in the first picture, the ureter is like a tube.
Yes.
So when the stone stops in this tract, the kidney doesn't stop functioning.
Yes.
So still there is urine coming out of the kidney. Is arrested at the stone site and cause back pressure for the kidney.
Exactly.
This is what causes renal colic. So some stones don't cause colic. Bladder stones don't cause colic.
Yes.
Renal stones in the lower or middle calyx, not reaching the renal pelvis, not usually causing colic.
So how would a bladder stone present?
Usually we found it while the patient is complaining of other symptoms. If it is a small stone pathing, it may found that the patient, while micturating, had arrested his micturation. Suddenly. It's a typical picture of having small stone passing through the posterior urethra.
That should be very painful.
Very painful. The patient is retained. Other stones and larger stones, we have it we are investigating for prostate, for having recurrent urinary tract infection, for having hematuria, irritative symptoms. This is regarding the bladder stones. Other stones, we start to do other investigations. As we see in this picture, this is a picture of Taraaweeh stones. Okay? You can see in these pictures, it's having any shape. It's having any shape.
Yes.
In the third picture, this is the bladder stones.
Yes, the next picture shows the
blood. This is the second picture. This is showing Taraaweeh stones. It's found in the kidney. It's having any shape.
Yeah.
The next picture is having bladder stones. You can see all these stones are formed in the bladder.
Yes.
This patient is having PPH, prostate. He is complaining of prostate, and he is not complaining of renal colic at all.
That's a huge one.
Yes. There are 4 stones. Then we start to investigate the patient. We usually do ultrasound and plain X-ray. This is the first simple investigation, and urine analysis, of course. If we found a pathology in the ultrasound or in the X-ray, we start to do more investigations. Usually the ultrasound finds stones in the kidney and in the bladder, not in the ureter. The ureter is small.
Too narrow to show the...
Too narrow to be shown by the ultrasound. If it's dilated, when it had the stones for a long time, more than 1 week or 2 weeks, it starts to dilate. So the ultrasound can see it.
So the size of the ureter can change by time.
Yes.
If the obstruction is
This is what we call hydroureter. The ureter is dilated.
And the patient would have still doing his urinary output because the other kidney is functioning.
And the obstruction is not usually complete obstruction. It's partial obstruction. When we do IVP for the patient, for example, we found the dye is passing beside the stone and completing the other ureter. So it's not complete obstruction. Sometimes it's partial obstruction. That's it.
Yes. We have a short break, and we will come back to see more about the investigations for the renal colic and the urinary stones. Brothers and sisters, we'll be going out for a short break, so please stay tuned. We'll be continuing, inshallah, after the break.
Islam covers all aspects of this life and the hereafter.
We begin with the letter A. A is for what? A is for Allah subhanahu wa ta'ala, the creator of the heavens and the earth.
The do's and don'ts, the freedom to choose, to decide our way of life.
My prayer, my fasting, my zakah, my hajj, my slaughter.
As per our wise creator's will or our uncertain human will.
Everything is only for Allah subhanahu wa ta'ala.
Bilal Ismail.
Purification